The Canadian healthcare system is collapsing, and I would like to know why. Last week, a medical professional reached out to me to talk to me about the current dysfunction of the healthcare system in Quebec. We had a 40-minute long phone call, and in what we discussed, I discovered that there was a few particular problems that were highlighted in this discussion. The thing that was most pertinent was the fact that administration is 90% of the reason for wait times in the hospital. Meanwhile, I had a conversation with a doctor in the private healthcare system who described to me that wait times to get a diagnosis for autism or for ADHD are taking up to 3 months and costing $25,000. The fact of the matter is that the Quebec government and a lot of the Canadian government has been investing in privatized options, which are increasing costs and increasing wait times. It seems that the cause of this problem is the lack of use of computers. There is still an over-reliance by doctors and medical care professionals for usage of pen and paper. So I reached out to the health minister of Quebec to discuss this with them. I asked them for an interview, and I said that I had found out a few reasons that there may be dysfunction, and I was interested in discussing it with them. She got back to me within the hour and said, "Could you please inform us of a few more details? I would like to know what we are going to have a conversation about." I was fairly honest. I said it seems that there is an over-reliance on administration, and I would like to discuss that. It seems that people are not using the computer systems that were designed themselves here in Montreal called Oasis. Meanwhile, I asked her to talk about the private system, and I said that I would like to discuss that people who are handicapped are still having several months of wait time and spending a fortune because they don't want to go to the public system, which is taking up to 3 years for a single diagnosis. I did pitch this story to Journal de Montréal, and I did pitch it to The Devoir, but neither of them have responded in the affirmative for that. So I've decided to just talk about it, and we will see what happens. I'm going to try and have an interview with them, and I will keep you updated as I find out more. We want a good healthcare system in Canada, and I think we deserve it. It is your right as a Canadian to have access to healthcare, and there are obvious solutions. So let's get to the bottom of this, and let's do some research. Check out my Substack, sign up for it right now, go like and follow, share this with your friends, blah, blah, blah. Have a nice day.